Welcome back. We continue our focus on Breast Cancer Awareness Month here on ABC 7 at 4, and I'm joined now by ABC 7 medical contributor Dr. Ogechika Alozie with Sunset West Health. Doc, we mentioned it yesterday here on ABC 7 at 4. 1 in 8 women in the U.S. will be diagnosed with breast cancer. But at the same time, we also need to focus on the positive.
Yeah, absolutely. And so when we talk about breast cancer, it is Breast Cancer Awareness Month. Like Mark said, it's about 1 in 8. But the good thing about breast cancer is that with early diagnosis, with early testing and the appropriate care, people can actually survive it, right? And so while it is the #1 killer in cancer of Hispanic women, there are over 3.8 million people that are survivors in the United States. And I think that's important. Right? We need to give people hope as much as we have to give them the tools to manage their own health care.
And we just said, as you mentioned, breast cancer, the leading cause of death in Hispanic women, but that's overshadowed by the number of cases and deaths in African American women.
Yeah, it's remarkable actually when we sort of look at the totality of breast cancer across all the races. And this is actually an inversion that we see, where we see Caucasian women actually have a higher incidence. Right? It's one of the few disease states that exists. I think what's really important to pick up here, obviously we live in a Hispanic community and we want to focus on that, but across the board, any woman needs to understand what their risk is and how they can actually get screened to prevent this from becoming something that becomes very life-changing for them.
And you know, we say it over and over, no matter what type of cancer you and I have talked about, early detection is key to treatment and survival. So how early in life should a woman get a mammogram?
I think first of all, it depends. If you have a family history of a first-degree relative, that's your mother or a sister, who developed breast cancer, you need to talk to your physician and clinician and figure out how to get that earlier. If not, then 40 to 44, start having that conversation about the option of screening every year. Once you get into the 45 to 54, that should be every year. And once you get 55 and older, it's really, again, a conversation with your physician. Do I need to do this? Do I have an expectation that I'm going to be alive 10 years? And that sounds morbid, but you may have diabetes or heart disease or something that you say, you know what, maybe I really don't need to go through this screening because it's undue heartache for me. And these are conversations you have to have with your clinician. That's me and you and I have talked about this a lot. Having a relationship with your physician or clinician is key to a lot of this.
All right, so let's say your mom, your sister, your wife, your girlfriend has had her mammogram. What happens after that?
Now, so the good thing is about 10% of those who have a screening mammogram will be told, hey, you need to come back, we need to look at something else. Of that 10%, let's call it 100, right? About 60% will have that additional imaging and absolutely nothing will happen. Then you take another 20% that will say, you know what, we're not really sure what this is. We want you to come back in 6 months and let's get this done again. Of the remaining 24, 19 of them will need to get a biopsy, right? And 5 of that remaining 100 will actually be diagnosed with breast cancer. I think the important thing, and we talked about this at the top, is that the cure rate for breast cancer is very high, but the asterisk there is if it's detected on screening. If you present with stage 3, stage 4 masses, that's not the conversation. This is critically why screening, whether it's breast cancer or colon cancer or anything else, is critically important to improving your health.
Now let's talk briefly about the local resources for women who have either been diagnosed with or who are currently fighting breast cancer. 3 great organizations. Desert Imaging, of course, does the Mammos on the Move, which has been around town. We had a representative from the Rio Grande Cancer Foundation on our show earlier this week. And of course, our dear friend and former co-anchor, Estela Casas, and her Stand with Estela Casas Cancer Foundation, all doing great work in this community.
Absolutely, and I think really the reality is, and we talk about this a lot, we have resources. Right? A lot of times people say, well, El Paso's too small, we don't have enough physicians and nurses. We do have resources, whether it's pediatric cancer that we talked about, whether it's breast cancer. These are 3 great organizations, and there's more additional mammogram facilities at the bottom.
ABC 7 medical contributor Dr. Ogechika Alozie, thank you very much.
Thank you.